We, in 2019, Tilganga received the certification of WHO Collaborating Center from the same Prime Minister who just left. And I'd like to let you know that that was an extremely proud moment for us. And our board in Tilganga, our executives, our staffs have, over the period of time, hours, days, months, and years, worked extremely relentlessly for a common goal, a vision, to provide comprehensive, inclusive, quality, and sustainable eye care with roots in the community. That was our common goal. And I take great pride in these people that I work with. I take pride in their skill, in their attitude, in their body language. It has been a wonderful many decades of working together with my colleague Rita and everybody else in Tilganga. I think it was, we started from scratch to this, what we are now. I also want to let the Honorable Minister, the Secretary of the Ministry of Health here to know that it's not very difficult to bring in hospital structures, infrastructures. But I think most difficult is the human resources. I always call the hardware is not very difficult, but it's the software which really gives you the impact, impetus, and the drive. So I think it's very important that the management of the software is extremely important. And in Nepal, we, along with many other stakeholders who have done tremendously fantastic work, have been able to, in the few decades, change the landscape of ophthalmology in a positive direction. One instance was Tilganga directly getting involved in reinventing small incision cataract surgery from the offices of Jerusalem to the communities, and we made it appropriately useful as a public health tool in the communities, and appropriating it to be integrated into the surgical delivery system, which helped to increase the cataract surgical coverage, cataract surgical rate, efficiency in many countries worldwide. And we also were one of the pioneers in this region to produce high quality, affordable intraocular lens, which was something that we could not think of having when we started with modern cataract surgery way back 3 decades ago. And to structure cataract surgically delivery system and refractive error delivery system, and subsequently develop subspecialty which was useful for the community. The other thing that we did very successfully was cost recovery. By instituting a pricing tier for the patients, we were successful in sustainability. And this model has worked very well, but it's important that we need to deliver good quality. Quality has to be sustainable, it has to be user-friendly, and there has to be commitment from the team and lots of good counseling. But cost recovery is extremely important in the next phase of our development in ophthalmology. And then we started scaling up our model beyond the boundaries to other countries, where we were received with affection and with lots of love because our model was effective, it was very steady, and it functioned very well in many other countries. So we are continuing to do that. Yeah. Thereby we started to contribute to both national and global health. We continue to come up with impactful innovations and training programs for surgical skills, refractive error, for many other processes. Now at this time, I like to mention TIO's, Tilganga Institute of Ophthalmology's, two formidable partners. The Himalayan Cataract Project, which now has become Cure Blindness, and the Fred Hollows Foundation. Two of our formidable partners. Interesting, we started about the same time, 3 decades ago. And very soon, in the next few days, the Himalayan Cataract Project is going to have its 30th anniversary. And Jeff, Katie, and we all will be celebrating it. Please come and join us. Tilganga's journey is more than a story of medical success. It is a narrative of hope, resilience, and profound impact to service of humanity. And before I conclude, I'd like to thank all the delegates here who have come from all over the world, and to IIPB for choosing Nepal as a venue. And just to let you know that if we have done the least, we have made Nepal self-reliant on
President, International Agency for the Prevention of Blindness, IAPB, Ms. Caroline. Chairman, International Agency for the Prevention of Blindness, Dr. Barbar. Professor Dr. Chitraj Panta, Professor Dr. Sanduk Rohit, Professor Dr. Gopal Prasad Pokhrel, Professor Dr. Madan Prasad Upadhyay, honorable delegates, distinguished guests, friends and partners, and friends from media. On behalf of the Ministry of Health and Population, I warmly welcome you all to Kathmandu for Insight Live 2030. This is an important moment as we reach the halfway point of the 2030 Insight strategy and work together global eye health targets. Nepal has a proud history in eye care, mainly innovative approaches started here, from community outreach to strong hospital network. But challenges remain: urbanization, aging, and lifestyle changes are increasing the demands for eye health services. The margin of blindness in Southeast Asia is still high. Nepal is committed to change. Eye health is part of our national health policy since 2019. We endorsed the WHO World Report on Vision and launched our National Eye Health Strategy in 2023. The 2022 survey showed that blindness has declined from 0.84% in 1981 to 0.28% today. We have also seen big improvement in cataract surgery coverage. Our goal is to reach 65.4% by 2030. We are expanding access through public-private partnership and our social health protection program, which now covers cataract surgery. We are also using WHO's tools to access our system and develop an action plan to 2030. Nepal support the 2030 Insight strategy, especially its focus on making eye health a key development issue, integrating it into national health system, and building strong partnership in school, workplace, and communities. We are proud to host the launch of WHO Specs 2030 and contribute a national segment. These tools will help countries set goals and track progress. Resolutions like the UN vision for everyone are important, but we must follow them with real action, policy, funding, and inclusive programs. We also strongly support the idea of a global summit on eye health in 2026 to move forward together. I would like to thank our global and domestic partners, especially IAPB, Tilganga, NNJS, and all eye health workers in Nepal.
It is therefore lifting that we convene here in Kathmandu, a city and culture shaped by centuries of resilience, vision, and hope, to consider the future of eye health in a world of rapid change. Today, we do not gather to speak of eye health in isolation, but to recognize it as a central force in shaping the broader arc of human development, from poverty reduction and education to gender equality and economic growth. Nepal's own journey reflects this truth. As a nation, deeply committed to the SDGs, we have made significant strides to ensure that no one is left behind, especially those at risk of losing their sight. In recent years, we have achieved key milestones. We completed the rapid assessment of avoidable blindness in 2022, creating a robust evidence base to guide our national priorities. Using this data, we set bold targets in our health sector, a strategic plan 2023 to 2030, including to 70% by 2030. We know that ambition alone is not enough. We must pair this with integration and innovation. That is why Nepal endorsed a new national eye health strategy, prioritizing the integration of eye health into our primary healthcare system and essential services. Eye health is no longer seen as a vertical program. It is part of our public health infrastructure. We are committed to translating this into action. We have introduced school-based vision screening and launched a school nurse program that includes eye health as a core component of student well-being, advancing both gender equality and access to education in line with SDGs 4 and 5. We have conducted a nationwide assessment using the WHO second tool and are now integrating eye health into our national health insurance program, reducing financial barriers and increasing quality of access. Most critically, we are embedding eye health indicators into our national health management information system, making it a core metric of progress. Ladies and gentlemen, these are not small efforts. They are part of a larger recognition that eye health is development. Without clear sight, a child may drop out of school. A parent may be unable to care for their family, placing the burden onto others. An elder may lose independence. A worker may lose livelihood. These realities ripple across our economy, our education system, and our communities. Eye health directly and indirectly impacts across most of the Sustainable Development Goals, from ending poverty and hunger to reducing inequalities and promoting climate resilience. In Nepal, we have included eye health in our voluntary national review for precisely this reason. We see the evidence, we see the urgency, and that which gets measured gets done. We also see the opportunity. The eye health sector is rich with innovation. From new diagnostics and treatment delivery models to partnerships that bridge health, technology, and development. But we must do more to scale and sustain these innovations where they are needed most. We must also ensure that these efforts are inclusive. Let think gathering reaffirm our collective commitment to equity and to ensuring that vision is a right, not a privilege. But Nepal cannot walk this path alone, nor can any country. This is why the world must come together, not in words, but in unity, action, and shared responsibility. And so, today, I am proud to reaffirm Nepal's full support for the 2026 Global Summit for Eye Health. This summit will serve as a vital platform to galvanize global and national action to end avoidable sight loss and ensure that everyone, everywhere, has access to quality eye care. With attention and resources being pulled in every direction, we are conscious that efforts need to be reduced in order that we don't lose this golden opportunity to develop this agenda and ensure eye health remain a priority. Nepal is committed to being part of this journey. We will contribute our experiences, our partnerships, and our political will to support the success of this global movement. Excellencies, friends, as we look to the decade ahead and the final stretch towards the Sustainable Development Goals, we are called to a greater ambition to match our promises with action and our shared values with lasting results. The path to 2030 may be complex, but our direction is clear. Let us work together to realize a world where every person, regardless of income, geography, age, or gender, can access the eye care they need to thrive. Nepal stands ready to collaborate, to learn, and to lead. Together, let us make 2030 not just a deadline, but a turning point towards a future that is more inclusive, more equitable, and as more visible. Thank you.
For their dedication. Let Kathmandu be the place where we move from vision to action and ensure everyone has access to eye care. Thank you. Dhanyavad.
Popular lens